What if I told you that the agonizing, sharp grinding sensation scraping deep beneath your kneecaps every single time you attempt to stand up from a low couch, the stubborn morning stiffness that leaves you frozen and limping for the first 30 minutes of your day, or that frustrating bone-on-bone ache that makes climbing a flight of stairs feel like an absolute mountain climb, has absolutely nothing to do with your knee joints simply being naturally worn out, old, or permanently destroyed beyond repair? Instead, what if the true, clinically proven medical reality behind your debilitating knee friction is caused by a silent biological starvation, a severe state of synovial drought, where your sedentary structural habits have literally locked your body's built-in lubrication pumps offline, leaving your sensitive joint cartilage to dry up, crack, and grind away in absolute friction? For millions of older adults over the age of 60 and 70, living with chronic knee pain and joint degeneration is one of the most anxious, limiting, and deeply isolating experiences of growing older. It almost always begins with small, subtle warning signs that you easily brush off as a normal consequence of life. You bend down to pick something up, and you hear a loud, crunchy popping sound deep inside your joint. A few weeks later, after an afternoon walk, you notice a dull, throbbing ache localized directly over your patella that requires you to immediately sit down and rest. Soon, you find yourself dreading ordinary daily activities, avoiding public stairs entirely, and carefully planning your grocery trips around the availability of automated shopping carts. Your immediate instinct is to seek aggressive conventional intervention. You visit a traditional clinic, receive a standard X-ray showing mild joint narrowing, and you are quickly handed a prescription for high-dose anti-inflammatory pills, ordered to wear bulky, hot neoprene knee braces, or offered a temporary series of localized steroid injections to artificially mask the inflammation. While these approaches aim to block the surface pain receptors, you quickly discover a deeply frustrating reality. The internal grinding remains entirely unchanged. Your surrounding leg muscles begin to waste away and melt from non-use, and you spend your days trapped in a state of continuous mobility anxiety, watching your world shrink, because you are terrified that your knees will simply buckle and fail beneath you. You accept the dangerous narrative that a surgical joint replacement is your only remaining option. But as a physician specializing in restorative biomechanics and musculoskeletal longevity, I am standing here today to completely challenge that defeatist narrative with absolute, unassailable biological evidence. Your knee joints are not static, dead hinges destined to wear out like the shock absorbers on an old car. Your joints are dynamic, highly responsive living structures. If your knees are grinding and aching, it is not because the cartilage is permanently gone. It is because your joint capsule is trapped in an emergency state of absolute mechanical dehydration. Every single articulating surface inside your body relies on a highly pressurized, ultra-slick fluid called synovial fluid, literally the biological engine oil of your frame. Cartilage contains 0 direct blood vessels. It cannot receive oxygen or nutrients from your bloodstream. Instead, it behaves exactly like a dense cellular sponge. To breathe and repair itself, it must be continuously compressed and decompressed through a specific, non-weight-bearing range of motion. This mechanical movement acts as the master biological valve that forcefully draws fresh synovial fluid into the cartilage cells while expelling inflammatory metabolic waste. But decades of structural stiffness, forward pelvic tilts, and full-body fluid stagnation have shut this pump down completely, leaving your joint space entirely dry and unprotected. Today, in this comprehensive, unified medical masterclass, we are going to completely tear down the traditional walls of senior knee care. We are going to isolate the exact mechanical and chemical bottlenecks that choke your joint infrastructure, examine the underlying fluid dynamics, and put a doctor-approved lifestyle protocol into immediate action. I am going to reveal the exact clinical blueprint of how your body's cellular sodium-potassium pumps regulate tissue volume, and expose the single most powerful key physical movement you can perform right from your bed or kitchen chair every single morning to instantly rehydrate your synovial space, eliminate bone-on-bone friction without surgery, and restore the absolute physical freedom and walking confidence you rightfully deserve. Before we uncover the profound anatomical mechanics of this master morning joint reset, if you want to shield your physical independence, stop the progression of joint degeneration, and secure your long-term mobility, please click that subscribe button below and turn on the notification bell so you never miss another senior health masterclass here on the Dr. Robert channel. To truly understand how a single morning exercise can melt knee pain away faster and more safely than harsh pharmaceutical pain blockers, we must first analyze the exact trajectory of joint breakdown that takes place under the surface of an aging frame past age 60. If you are completely ready to break the cycle of chronic knee stiffness, flood your starving joint capsule with fresh lubrication, and lock in absolute structural vitality with me today, please type 1 in the comments section right now. If not, drop a 0 so I can learn exactly how to tailor these deep clinical masterclasses for your specific physical goals. Let's look past the surface of your skin and examine the raw physiology of your knee joint. The knee is a complex hinge joint where the massive femur of your thigh meets the tibia of your shin bone. Capping the front of this assembly is the patella, which slides up and down within a specialized groove. To prevent these hard bones from violently grinding against one another, nature lines the surfaces with an incredibly smooth layer of hyaline cartilage, which is technically slicker than ice on ice when perfectly lubricated. However, as we step past age 60, standard modern lifestyle patterns place our structural joints into what advanced orthopedics refers to as the friction clamp. It begins with the hours we spend sitting completely motionless inside deep, plush couches or office chairs. The moment you sit with your knees bent at a continuous 90-degree angle, you are placing your quadriceps tendon and patellar ligament under immense, sustained static tension. This constant tightness pulls your kneecap backward with severe force, smashing it directly against the underlying femur. This mechanical clamping force pushes out whatever tiny reservoirs of synovial fluid were left remaining inside the cartilage sponge. As this fluid depletion continues for hours on end, the dry cartilage cells enter a profound state of localized hypoxia and starvation. At the exact same time, a parallel molecular disaster is taking place inside the joint capsule due to a process called advanced glycation end products, or AGEs. When you consume refined carbohydrates or hidden processed sugars, glucose floats freely through your system and binds permanently to the flexible collagen fibers within your joint capsule, turning them into rigid, tough, unyielding strands. This sticky sugar crust completely paralyzes your endothelial and synovial cells, forcing them to stop synthesizing fresh fluid. Your joint stays dry, clamped down, and heavily prone to localized micro-tearing. The next time you attempt to stand up, your dry, rigid bone surfaces slide across one another without an insulating layer of biological oil. This is the exact origin of that agonizing bone-on-bone friction and grinding. Swallowing an aggressive chemical pill to temporarily numb your brain's perception of this friction without clearing the cellular caramel crust or activating the internal lubrication pump is a dangerous biological mismatch. To truly reverse knee pain, we must utilize a strategic mechanical intervention. We must engage in a precise, targeted, non-weight-bearing movement that systematically flushes out the stagnant fluid blocks, releases the tight patellar clamp, and forces a massive, pressurized surge of fresh, nutrient-dense synovial fluid straight back into the cartilage sponge. We have exposed the structural enemies, the mechanical friction clamp pinning your kneecap, and the sticky molecular sugar crust paralyzing your synovial fluid synthesis. Now, it is time to put our medical knowledge into direct, powerful, physical action right here in the room. Many older adults assume that if they want to strengthen their knees, they must engage in high-impact exercises like heavy squats or long jogs, which smash their bones together and trigger intense joint inflammation. But in advanced restorative medicine, we understand that forcing a dry, starving joint capsule to move under heavy weight-bearing load before unlocking the internal fluid highways is an immense clinical error. Today, I am going to reveal our highly strategic, low-impact, 5-move at-home mechanical realignment protocol centered around our master corrective morning exercise. All you need is a firm kitchen chair, a clear wall, and less than 10 minutes of daily attention. Let us break down these 5 corrective movements with absolute clinical precision. Movement 1. The seated synovial pendulum. Pendulum flush, the key movement. This is our absolute premier weapon to eliminate bone-on-bone friction and instantly activate the built-in lubrication pumps inside your knee capsule without introducing an ounce of weight-bearing pressure. Sit completely tall right at the front edge of your firm kitchen chair. If your chair is too low, place a firm, folded blanket onto the seat to elevate your hips so your feet hang completely free, slightly clear off the floor. Do not lean your spine back against the comfortable cushioning. Hold your head high, roll your shoulders back, and pull your shoulder blades together to align your posture. Place your thighs parallel to one another, hip-width apart. Keeping your upper thigh muscles completely relaxed, slowly and intentionally swing your lower leg forward and backward from the knee joint, exactly like a smooth, rhythmic clock pendulum. Swing the foot forward until the leg is nearly straight, then allow it to smoothly swing back beneath the chair as far as comfortable. Do not use explosive muscular force. Instead, use the natural momentum of your leg weight. As you swing smoothly back and forth, the joint capsule experiences continuous, gentle compression and decompression. This action acts as a mechanical vacuum, forcefully drawing stagnant fluid out of the cartilage pores and sucking fresh, nutrient-dense synovial oil back in. Execute this continuous, relaxing swing for 90 full seconds per leg. Repeat for 3 total rounds every single morning before you walk. Movement 2. The countertop bamboo, Achilles tensor. This movement targets the thick, rigid tendons running down the back of your lower ankle and calf, which act like a physical constriction band that pulls your tibia backward, severely altering your knee alignment and driving up patellar joint friction. Stand completely tall and proud, facing your kitchen counter, a solid table, or a flat wall. Place both of your hands flat on the surface at chest level to serve as your absolute balance security button. Step your right foot backward about 18 to 24 inches, keeping your left foot forward. Keeping your rear right heel completely glued flat into the floor, and your right leg perfectly straight, slowly bend your front left knee and shift your entire torso forward toward the counter. Move forward until you feel a deep, intense, warm, lengthening stretch, stretching all the way down your right Achilles tendon and upper calf. Once you reach that point of deep stretch, do not bounce. Hold the position in absolute stillness. Take a deep, 4-second breath in through your nose, expanding your stomach, and as you slowly exhale through pursed lips for 6 seconds, let the tension completely melt away. Hold for 30 continuous seconds per leg. Complete 2 rounds per side. Unlocking this lower bottleneck instantly restores perfect mechanical tracking to your knee hinge. Movement 3. The seated femoral highway unkinker. This movement is specifically designed to address the mechanical kinking that occurs inside your hip creases from spending long hours sitting in soft recliners, which deactivates your hip flexors and causes your quadriceps to overcontract, tightly clamping down your kneecaps. Return to your tall, seated position at the front edge of your firm chair. Grip the metal or wooden side frames of the seat tightly with both hands to stabilize your pelvis. Keeping your posture long and your chest proud, slowly elevate your right knee upward toward the ceiling, about 4 to 6 inches clean off the ground, exactly like performing a slow-motion march. At the absolute peak of this movement, flex your foot by pulling your toes back toward your shin and hold your leg suspended in mid-air for 2 full seconds. Do not let your foot drop or slap back down unguided. Lower it down with immense control over a 3-second count, placing the sole flat on the floor like you are stepping onto thin ice. Immediately alternate to your left leg. Execute 10 slow, calculated marches per leg for 2 full sets. This rhythmic compression forces the massive, deep lymphatic and vascular collection hubs inside your groin to pop open, balancing lower limb tension. Movement 4. the lateral wall-supported pelvic brace. This exercise activates your outer hip stabilizers, specifically the gluteus medius, which control the alignment of your thigh bone and prevent your knee from collapsing inward when you walk. A primary mechanical error that tears down inner knee cartilage. Stand tall sideways next to a flat wall or your kitchen counter. Place your inside hand firmly onto the surface for absolute balance protection. Stand with your feet pointing straight forward, touching each other, keeping your torso perfectly upright without tilting your shoulders. Slowly sweep your outside leg out sideways to the side about 12 inches. Keep your toes pointing straight ahead. Do not let your foot twist outward. Hold this lateral suspension for 1 full second at the peak, feeling the muscles on the side of your hip firing tightly. Slowly bring the leg back inward over a 2-second count until your feet touch. Complete 12 controlled lateral sweeps on one side, then turn around to train the opposite leg. Perform 2 sets. Activating these lateral outer guards stabilizes your leg tracking, eliminating the grinding shear forces inside your knee joint. Movement 5. The seated carotid carina deep diaphragmatic release. This final movement does not target your leg muscles. Instead, it directly targets your autonomic nervous system, dampening the systemic stress and emergency adrenaline that flood your body when you are dealing with chronic, wearisome joint pain. Sit completely relaxed but tall in your chair. Rest your hands flat on your lap with your palms facing upward. Close your eyes down completely. Rest the tip of your tongue gently against the roof of your mouth right behind your front teeth. Slowly inhale a deep breath in through your nose over a quiet 4-second count. Do not lift your shoulders or puff out your chest. Instead, drive the air deep down into your belly, forcing your abdomen to expand outward like a balloon. Hold that deep volume of air in your lungs for a brief 2-second pause. Now, open your lips slightly and slowly exhale that breath out through your mouth like you are blowing through a tiny straw. Extend this exhale over a slow, continuous 7-second count. As you empty your lungs, feel your shoulders drop and your entire nervous system down-regulate. Complete 8 continuous rhythmic breaths. This activates your vagus nerve, sending an immediate chemical message down your spine to slow your heart rate, decrease full-body vascular resistance, and open the flow of nutrients to your recovering lower joints. Our physical foundation is now completely secure, and our joint pathways are mechanically unkinked. Now, we must turn our attention to the biochemical matrix that works alongside our physical movements. To achieve long-lasting joint restoration after age 60, you must complement your physical exercises with targeted nutritional activation. We need to introduce highly specific, nutrient-dense plant structures that function as direct cellular keys to balance your internal hydraulics, clear tissue congestion, and maximize fluid delivery to your joint capsule. Every single cell inside your body contains millions of tiny, built-in structural engines known as the sodium-potassium pump. Think of this pump exactly like a highly calibrated, two-sided swinging security door regulating your internal fluid pressure. When hidden industrial sodium accumulates from modern processed foods, it acts like a powerful biological sponge, drawing and holding immense volumes of water into the spaces surrounding your tissues, waterlogging your capillary beds, and driving up back pressure against your joint capsule. To reverse this fluid leak, your body desperately requires bioavailable organic potassium and specific vasodilating plant compounds. Potassium is the biological master key that swings the cell door open, pulling water back inside the cell where it belongs and sending a direct chemical signal to your kidneys to flush the excess stagnant fluid out into your urine. Vegetable Code 1, mustard greens, Gaibe san, and the glucosinolate renal reset. Mustard greens contain an elite concentration of glucosinolates and bioavailable organic potassium, combined with a massive dose of vitamin K. The unique glucosinolates and sulfur compounds that give mustard greens their sharp, slightly bitter taste act directly as a natural, non-chemical stimulant for your liver and kidney filtration pathways. It actively prompts your renal system to clear excess extracellular sodium reservoirs, forcing trapped fluid away from your congested knee capsule. Integrate 1 cup of gently steamed or blanched mustard greens into your diet 3 times a week. Vegetable Code 2. Crisp organic celery and the Thalide Muscle Reset. Celery stores an exceptionally rare, highly active organic chemical compound known as thalides. The specialized thalides inside celery act directly on the smooth muscle tissue lining the middle layer of your artery walls. Thalides work by gently blocking the influx of calcium into the muscle cells, which prevents them from cramping and constricting. This action forces your tense, narrow blood vessels to smoothly widen and relax, allowing fresh, oxygen-rich blood to reach your surrounding leg muscles. Aim to consume 2 to 3 raw, organic celery stalks every single morning. Vegetable Code 3. The organic crimson beet and the deep hydrostatic flush. The deep red beet is a legendary vascular and structural therapy asset, packed with an incredibly high concentration of inorganic dietary nitrates. The exact moment you digest beets, your body converts these nitrates into pure nitric oxide, NO, the master key that commands the smooth muscles around your leg veins to open and relax. This removes the mechanical vascular roadblock, allowing stagnant blood to travel back up your body effortlessly and nourishing your joint tissue. Enjoy half a cup of roasted or gently steamed beets with your evening meal. Furthermore, we must bridge the gap between nutrition and your actual 24-hour daily living environment. Longevity and perfect joint stability are quietly constructed out of safe, repeatable daily lifestyle defenses. To eliminate the high risk of a sudden morning pressure spike or orthostatic fall when stepping out of bed, you must implement the 5-second transition rule the very moment your eyes open. Step 1. The lateral awakening. When you first wake up, do not immediately sit up. Remain flat on your mattress, roll gently onto your left side, and take 3 deep, slow abdominal breaths to allow your baseline heart rate to stabilize. Step 2. The seated equalizer. Slowly push your upper body up and sit completely upright on the absolute edge of your bed frame, allowing your feet to hang down flat toward the floor. Count to 5 slowly in your mind. This 5-second pause gives the specialized pressure sensors inside your neck arteries the exact time window they need to adjust your blood vessel tension against the downward pull of gravity, completely preventing sudden dizziness, blurry vision, and morning falls. Step 3. The priming pump. While sitting on the edge of the bed during those 5 seconds, perform 10 quick rhythmic ankle pumps, peeling your heels up and your toes up. This immediately fires your second heart calf engine, driving fresh blood straight back up to your skull and mobilizing your lower extremity fluids before you stand up. While implementing these powerful natural movements and optimizing your daily nutrition will drastically improve your joint health, true medical wisdom requires you to maintain an absolute baseline of diagnostic awareness. You must completely memorize these non-negotiable emergency markers. If you ever experience any of these symptoms, stop all activity immediately and seek emergency medical evaluation right away. 1. The asymmetrical leg flush. If you notice a sudden, rapid increase in swelling that is strictly localized to just one single lower leg or bapchun, accompanied by intense, throbbing pain, deep redness, or skin that feels unusually hot to your touch, this is a classic clinical indicator of a deep vein thrombosis, DVT, a dangerous blood clot trapped inside your veins that requires immediate medical emergency intervention. 2. The ischemic chest vise. Any sudden sensation of heavy pressure, squeezing, tightness, or a crushing ache localized deep behind your breastbone, especially if that pain begins to radiate outward down your left arm or up into your jawline, accompanied by an unexpected cold sweat. 3. The neurological switch. The sudden onset of intense, room-spinning dizziness, a sudden numbness or loss of motor control localized to one single side of your face or body, or sudden difficulty speaking. These are the definitive warning signs of an acute stroke. As a final critical physician's warning on active lifestyle adjustments and nutrition, because vegetables like mustard greens are exceptionally rich in bioavailable vitamin K, you must exercise high precision if you are currently prescribed traditional blood-thinning medications, such as warfarin or Coumadin. Do not make sudden, drastic spikes or drops in your daily consumption of greens, as it can alter your clotting times. Maintain absolute consistency, and always consult your primary care physician to tailor your monitoring to your healthy, nutrient-dense lifestyle. Living your retirement with true dignity, supreme physical freedom, and absolute peace of mind means taking total command of your daily biological choices. By taking control of your daily habits, protecting your vascular and synovial endothelium, and keeping your internal pumps active, you are securing the freedom and longevity you rightfully deserve. Please take a brief moment right now to comment below with your current age, and share which room in your home you are going to audit for loose throw rugs or trip hazards first today. Click that like button, share this vital guide with a contemporary who is struggling with chronic bone-on-bone knee pain, and subscribe to Dr. Robert to safeguard your longevity journey. Thank you so much for watching. Keep your foundation strong daily, and I will see you in our next video.